Across our area, COVID vaccination rates are stalling. Harris County Public Health says less than 45% of the population is fully vaccinated, and hospitalizations are rising dramatically. State health officials confirm Texas saw more than 1,300 new cases Monday. That is down from the past 2 days, but if you just stop for a moment and take a look at that yellow line on this graph, it shows the 7-day average of new cases, and you can see that it has been climbing for the last 3 weeks. Right now, we want to get an update from Memorial Hermann. I'm joined by President and CEO Dr. David Callender. Good morning to you, Dr. Callender.
Good morning.
Well, you and I talked at 1st of July, and there was concern that the July 4th week could be a super spreader, and it looks like since that time, hospitalizations have quadrupled since then.
That's correct. We're certainly seeing that across the greater Houston area.
All right, let's talk about vaccinations, because we know that from what we're seeing in our area, it's about half and half about how people feel about it. But let's talk numbers here. What % of people who are getting COVID or who are at least being hospitalized with it are vaccinated?
Well, in Memorial Hermann's case, it's well over 99% of those who are hospitalized are unvaccinated. So Delta is predominantly moving among unvaccinated people.
All right, so it sounds like just 1% of the people who have a vaccine are being hospitalized. Is that about the same on breakthrough cases? Have you seen more with this Delta variant, or has it been about the same of 1% hospitalized throughout this pandemic?
Well, actually, for us, it's about 0.5%.
Half, okay.
Melissa, yeah, so of those hospitalized are vaccinated. What we're seeing is a little bit higher rate of breakthrough infections with Delta for those who have been vaccinated, but breakthrough infections aren't leading to hospitalization. So again, those being hospitalized are those who are unvaccinated who have more severe infections.
I just reported moments ago that vaccines in the Houston area have stalled, so it's not like people are running out now to get it. So let's talk about vaccine hesitation. When you were able to report that only 0.5% of people are being hospitalized with COVID now who have received a vaccine, do you feel like those numbers might prompt more people to perhaps consider a vaccine if they haven't before?
I think so. In fact, I think we're seeing that. We've seen an uptick in the number of people seeking vaccination over the course of the last week to 10 days. It's beginning to move up again. We're hopeful, although we certainly don't want anybody to become ill. The fact that Delta is moving aggressively among the unvaccinated seems to be convincing some people to be vaccinated.
And usually, Dr. Callender, as you know, this is an exciting time of year for kids to start getting their new school clothes and their back to school supplies. But instead, all we're hearing is just some pretty deep concerns from parents about unvaccinated children. Can you talk more about that and what you hope might happen to help protect our kids, or if there's anything that we can do to consider trying to protect them as they head back into large groups soon?
Yeah, again, children do well with COVID. First of all, those less than 10 seem to be less likely to become infected. Now, Delta moves a little bit more aggressively than some of the other variants, but young children seem to be a little bit resistant to infection as compared to adults, so that's a good thing. That said, we're still recommending that children under the age of 12 wear masks when they return to school. Masks are not mandated in public schools in Texas, but we think that's a good idea based on what we know today.
And I think it's so important for us to be educated about this situation and to understand perhaps where our more vulnerable populations are. Are you getting any key indicators or any idea of where our more vulnerable are and what we can do to try to help protect them as Delta variants keep bringing more people to the hospital?
Well, actually, those who have yet to be vaccinated, we know that vaccine hesitancy rates and some of the other factors that impact someone's ability to be vaccinated are more of a concern among Latinos and African Americans. And so, a lot of our efforts today are focused on the higher risk populations, getting out into neighborhoods, getting to churches, getting to work with trusted partners so that we can make vaccination more available to those at higher risk.
All right, Dr. Callender, I always find you to be a calming communicator. Thank you for taking time from Memorial Hermann today to walk us through and explain to us what's happening at your hospital so we can get a better idea of how to proceed, well, I guess, with our own lives in a way. Thank you again.
Thank you.